Dr. Gazsi, would you talk about your treatments for colitis?
Colitis is an inflammation in the intestine, and the trick to treating colitis is to find what is causing that inflammation. And that can be a lack of nutrients that the intestine needs to function properly. It can be due to a food sensitivity. The person's eating a food that is irritating the colitis, or it can be due to a bacterial imbalance or yeast overgrowth in the intestine. So testing for nutrient levels is very important in the case of colitis, making sure the body has the nutrients it needs to heal and bring down inflammation in the intestine. Fixing the bacteria balance in the intestine is very important, making sure there's not a lot of bad bacteria or yeast overgrowth, making sure there's good bacteria, and testing for food sensitivities, not food allergies, but sensitivities, which is very different, foods that trigger inflammation in the intestine. And once we know what foods, we pull those out of the person's diet, we correct the bacterial balance, we give the nutrients they need, and we find most people do very, very well without, eliminate the outbreaks and the symptoms associated.